Hi everybody, this is Dr. Sadri, board certified ophthalmologist here in lovely Newport Beach, California. It's just absolutely wonderful to be here with you. I get a lot of questions, both from our patients here, but also online about different topics. So if you have any questions or things that you want to go over, please comment below. That's what we're here for. But the common question I always get asked is, what is a floater? Why do I see these geometric shapes flying around in my vision? Do they hurt my eye? Are they dangerous? Is it a retinal detachment? Do I need surgery? Do I go see a surgeon, optometrist? So floaters are part of the eye. Floater is nothing more than what we call vitreous floater. The vitreous is a jelly made out of collagen and hyaluronic acid. The same stuff that's in our skin and our face basically comprises in our eyes. The eye is not a ping pong ball. It's got stuff in it, and it's got water and got jelly. When we're young and jelly is clear, you can see everything. When we get older, the jelly starts to clump together like pieces of fruit and jello, and they start to cast a shadow on the retina. And they tend to move around. I bet you bottom dollar, if you would look at a white background and really focus, you'll see them. I actually see them while I'm doing this right now. I have to kind of ignore them. Sometimes they come on and they're pretty strong and they get in the way and they're really annoying and can cause vision disturbances to a point where a patient wants actual treatment done. So what are those treatments? Number one is really observation. The biggest thing and safest, the data shows the safest thing is just observe, don't jump into surgery, because most of the surgeries can be pretty invasive. Rarely, occasionally, we do have patients that really want a treatment. There's lasers, vitreolysis now available here in the United States. So basically you use a beam of laser, which is called a YAG laser, typically used to break up the little jelly inside the eye. Again, pretty invasive, has some known side effects. In some patients has been shown to be pretty efficacious, but generally pretty rarely used and typically may or may not be covered through your medical insurance. So the jury is out on that. It's pretty controversial in our field. I would say for the majority of patients, these things do come and go. Rarely, but occasionally, patients do suffer from really bad floaters where it doesn't go away, the laser doesn't work, and they can't see. And these patients undergo what we call a vitrectomy, which is basically the surgeon going in and removing the jello of the eye on an outpatient basis. Pretty invasive, pretty hardcore surgery. I would say that's very, very risky for someone that's all they need. Most retinal surgeons that I know do not do that because it can lead to other things like further detachment, infections, cataract. So in a nutshell, the floaters are common. They're benign. 98% of people have them. They'll come and go like clouds. They're nothing to worry about. Other conditions that can cause floaters, which can be serious, are something called retinal tear detachment. This is something not to be ignored. A retinal detachment or tear is different from just a floater because the floater gets bigger and more pronounced, usually in one eye, although it rarely can be in both eyes. But more importantly, it comes with something called flashes. So the patient's sitting there, there's a bunch of flashes, and these are not occasional flashes, these are flashes that are strong, and the patients may or may not describe something coming down, like a curtain coming down the side. That could be something serious called a retinal tear or detachment, which the patient should go to the emergency room. The combination, if you notice, flashes and floaters, not just floaters by themselves, decrease in vision. Definitely, I would recommend seeing the doctor right away. Hope that helped. Further questions, if you have any in the future, let me know. Please don't forget to press the subscribe and like button. We're here for you. It's been a pleasure.